Marcus is 6 years old, and he goes to River Springs School. We just love Marcus. That's a terrific kid. He likes to play. He likes to imitate Superman and imaginary friends. One Sunday, we just got out of church. January 28th, came home. When we came in the house, his sister laid down. He went to the bathroom. And of course, I went upstairs. I was thinking about changing my clothes or something. My TV was not on. So when he came out the bathroom, and I was upstairs and I heard something, the TV shot up loud. And I'm like, wait a minute, now I know I ain't telling him to cut that TV on. So when I came running down the stairs, Marcus was on the floor having a seizure and a stroke. And I'm like, what? So I jumped on him, and when I got to him, I said, in the name of Jesus, come out, praying for him at the moment. And then I went to call my husband because he was outside. And I called 911 for the paramedics to come. He was paralyzed on one side. When they got here, we got him ready, took him to Richard Memorial Hospital, and they kept him and observed him, and he did have a seizure and a stroke. So then they had a couple of doctors came in, looked at him, and over and over and over. And because he had a black mark on his arm, we thought it was a mole, but when they looked at him and saw the black mole on his arm, and he had like more than one. So then they started coming up with some things saying that he had a moyamoya.
While Marcus was here, he had imaging of his head, including a CAT scan and then an MRI to see what had caused him to have a seizure. And I was actually brought in as one of the final consultants in his care when it was discovered that he had a stroke and that the stroke was from something called moyamoya disease. At that point, Marcus had been managed by his pediatric service and pediatric neurology as well to ensure that his seizures were brought under control. Moyamoya disease is a rare condition where the blood vessels at the base of your brain, the big blood vessels that feed your brain, start closing off slowly. Your body starts trying to form smaller blood vessels that go up from the big blood vessels in order to try and get blood to your brain. Those form what looks like a puff of smoke on something called cerebral angiography, and that's what moyamoya means. Surgery to correct moyamoya disease usually works better in children. In Marcus's age group, he wasn't big enough for us to go put a new blood vessel into his brain, so we literally just opened up his skull and took another blood vessel that's a blood vessel that we all have in the skin over top of our skull and redirected it to underneath the skull, giving the brain a place to draw blood vessels from. While he's always going to have moyamoya disease, we should be able to keep him from having another stroke.
We had everybody praying, the church family praying, even the doctor. And when he had the surgery, everything came out just fine. He went through his little procedure for like 5 days, and then after 5 days, he was back to Marcus. Same Marcus, I'm like, okay. Dr. McClung-Smith, that woman and her team, her staff, best ever. Oh, wow. I mean, it seemed like we just became family.
If you believe that your child is experiencing the symptoms of a stroke, do not hesitate. Anytime that a stroke is occurring, time is brain. Call 911 and have your child taken to the nearest emergency room. Here at Prisma Health Children's Hospital, as part of a comprehensive stroke center, we're able to ensure that your child receives the best care possible during this critical time.